Heart disease does not always hide inside the chest. Sometimes the body broadcasts clues on the outside, visible signs that reflect what is happening with your circulation, your heart's workload, or how well oxygen is reaching your tissues. None of these signs in isolation means you definitively have heart disease, but they are signals worth understanding, because recognizing them can prompt the right investigation at the right time, and the earlier cardiovascular disease is identified, the more options you have to change its course. My name is Dr. Victor Hayes. Let me walk you through 7 visible signs of heart disease, explain what is driving each one, and tell you which combinations should prompt you to speak to a doctor without delay. Sign number 1 is swelling around the ankles, feet, or lower legs, particularly swelling that appears or worsens toward the end of the day and leaves an indentation when you press on it for a few seconds. That is called pitting edema. Ankle swelling has many causes: long flights, hot weather, certain medications, prolonged standing. Most of the time it is benign, but it can also be an early sign that the heart is not pumping with full efficiency. Here's the mechanism. When the heart begins to weaken, blood can back up in the venous system, the veins returning blood to the heart. That backed up pressure forces fluid out of blood vessels and into surrounding tissues. Gravity pulls it downward, which is why it appears in the ankles and feet first. In someone spending long periods lying down, it may appear in the lower back instead. The signs that matter clinically are swelling that is persistent, swelling that is progressively worsening over weeks, or swelling accompanied by breathlessness, fatigue, or an awareness of your heart's rhythm. New or worsening edema in someone over 50 or in anyone with known risk factors like high blood pressure or diabetes should prompt medical assessment. One additional point: if you notice swelling in just one leg, asymmetrical, hot, tender, or painful, that needs urgent assessment as it may indicate a deep vein thrombosis. Sign number 2 is small, yellowish, slightly raised patches appearing around the eyelids, usually near the inner corners. These are called Xanthelasma, and they are deposits of cholesterol beneath the skin. They cause no symptoms and no visual impairment, but they are a visible marker of what may be happening inside your arteries. When LDL cholesterol, the type associated with arterial plaque formation, is chronically elevated, the body can begin depositing that excess cholesterol in tissues where it does not belong, the walls of your arteries and sometimes the skin. Xanthelasma represents the skin manifestation of that same process. Not everyone with high cholesterol develops xanthelasma, and not everyone with xanthelasma has severely elevated cholesterol, but the association is meaningful. Studies have shown that people with xanthelasma carry a higher risk of heart attacks and coronary artery disease even after controlling for other risk factors. If you notice these patches developing, especially if you have a family history of cardiovascular disease, it is a reason to have your lipid profile tested. Managing cholesterol through diet, exercise, and medication when appropriate can meaningfully reduce cardiovascular risk, even when the patches themselves do not fully resolve. Sign number 3 is a gray or white arc forming around the outer edge of the colored part of the eye, the iris. This is called corneal arcus, and whether it matters depends significantly on your age. In people over 60 or 70, corneal arcus is extremely common and generally benign, a normal aspect of aging related to lipid accumulation at the corneal periphery. When it appears in people under 50, particularly under 40, it becomes a different clinical signal. In younger individuals, corneal arcus is more strongly associated with lipid abnormalities, elevated cholesterol or triglycerides. There is meaningful evidence linking early corneal arcus to increased cardiovascular risk in younger adults, particularly men and those with a family history of premature heart disease. It causes no symptoms and does not affect vision. But if you are in your 20s or 30s and someone notices this ring around your iris, that is a reason to have your cholesterol tested, not to panic, but to know your numbers. Sign number 4 is unusual pallor or a patchy, mottled appearance of the skin, particularly visible during physical exertion. When a healthy heart increases its output during exercise, it delivers more oxygen-rich blood to working muscles and maintains adequate skin perfusion. When the heart is weakened or when coronary arteries are significantly narrowed, the body begins to ration blood flow under demand. It prioritizes the vital organs, the heart itself, the brain, the lungs, and diverts blood away from the skin and extremities. The result is that the skin loses its normal color during exertion. In some cases, a mottled pattern called livedo reticularis becomes visible, a lace-like reddish-purple discoloration reflecting sluggish blood flow through the small vessels of the skin. This sign is particularly meaningful when it is new, when it is consistently reproducible with physical effort, and when it comes alongside breathlessness, chest discomfort, or lightheadedness. Pallor alone can reflect anemia, low blood pressure, or simply being cold. But pallor during exercise, in someone with cardiovascular risk factors, warrants investigation. Sign number 5 is a bluish tinge to the lips, fingertips, or nail beds, a sign called cyanosis. This reflects reduced oxygen content in the blood, either because insufficient oxygen is being loaded into the blood in the lungs, or because blood flow is insufficient to deliver adequate oxygen to peripheral tissues. Once you have seen cyanosis clinically, you do not forget it. There are 2 main types: central cyanosis, affecting the lips, tongue, and mucous membranes, suggests a problem with oxygenation at the level of the heart or lungs, severe heart failure, congenital heart disease, or significant respiratory disease. Peripheral cyanosis, affecting the hands and feet, tends to reflect sluggish peripheral circulation, often because the heart is not maintaining adequate output to the extremities. Cold weather can cause peripheral cyanosis in otherwise healthy people. The concern arises when it is persistent, when it occurs at rest in a warm environment, or when it worsens with mild activity. Cyanosis in those contexts always requires medical evaluation. It is a sign that oxygen delivery is compromised, and it should never be normalized or dismissed. Sign number 6 is clubbing of the fingertips, where the ends of the fingers become enlarged and bulbous, and the normal angle between the nail bed and the finger straightens out, or reverses. The nails take on a curved watch glass appearance. Clubbing is striking once fully developed, but it develops gradually over months or years, which is precisely why people often do not notice it themselves until someone else points it out. In the context of the heart, clubbing is most commonly associated with congenital heart disease that causes chronic low oxygen levels, where oxygen-poor blood bypasses the lungs and circulates systemically. In adults presenting with new clubbing, the cardiovascular differential includes infective endocarditis, an infection of the heart valves, alongside lung disease. The important clinical point is that clubbing indicates chronic, ongoing physiological strain. It does not develop acutely. By the time it is present, something has been happening for a significant period. If you notice your fingertips have progressively changed shape, or if someone draws your attention to it, that warrants medical investigation, not urgently in most cases, but not indefinitely postponed. Sign number 7 is one that most people would never identify themselves without specific medical knowledge, but that a physician assessing you would look for explicitly. It is jugular venous distension, visible prominence of the jugular vein in your neck. The internal jugular vein runs along the neck and connects ultimately to the right side of the heart. Normally, when you are sitting or standing upright, this vein should be flat and invisible or barely perceptible. When pressure in the right side of the heart is elevated because the right ventricle is struggling, because heart failure is driving back pressure into the venous system, or because of certain lung conditions, blood backs up into the great veins of the chest and neck. The jugular vein becomes visibly distended. Clinically, we assess this with the patient reclined at 45 degrees. If the vein is visible above the collarbone in that position, it is abnormal. It is a sign that the heart is not coping well with its volume or pressure load. This is not something most people assess themselves, but a doctor or healthcare professional conducting a proper physical examination will look for it, which is one reason that a thorough in-person examination still matters, particularly in an era where consultations are often brief or remote. These 7 signs rarely mean anything on their own in isolation. What matters are patterns. Ankle swelling alongside prominent neck veins points toward fluid overload and heart failure. Xanthelasma alongside corneal arcus in a 40-year-old points toward a significant lipid problem. Cyanosis alongside clubbing points toward chronic low oxygen from heart or lung disease. Think of them like warning lights on a dashboard. A single light in isolation may mean very little. Multiple lights appearing together, or the same light returning repeatedly, tells you something needs attention. The real power of understanding these visible signs is that they can appear before symptoms become obvious, before breathlessness at rest, before chest pain at night, before a cardiac event. That is the window where prevention and early intervention have their greatest impact. What drives all of these signs are the same modifiable risk factors that drive cardiovascular disease in general: high blood pressure, elevated blood sugar, smoking, physical inactivity, poor diet quality, chronic unmanaged stress. These factors damage blood vessels, strain the heart, and accelerate disease over years and decades. Blood pressure control is probably the single most impactful factor for most people. Regular physical activity improves cardiac output, lowers blood pressure, improves lipid profiles, and reduces inflammation. Dietary quality affects cholesterol levels, blood sugar, and systemic inflammation simultaneously. Sleep quality matters enormously. Poor sleep drives blood pressure upward and promotes inflammatory and metabolic dysfunction. The good news is that many of the visible signs I have described can improve as the underlying burden on your cardiovascular system improves. Edema resolves when heart function is optimized. Cyanosis improves when oxygen delivery is restored. Even xanthelasma can slowly fade when cholesterol is consistently and effectively managed. Your body is communicating with you. Understanding what it is saying gives you the ability to act before the situation becomes significantly harder to address. If this was useful, please subscribe to this channel and share it with someone who would benefit. I will see you in the next video.